Hello, everyone, and a very warm welcome to all of you to the session today. Um, I appreciate Parent Circle for inviting me on to this session, and I'm looking forward to having an interactive session with all of you. Um, so, as we know, that today's session is about autism and early diagnosis and intervention in autism. And what we are going to do in the next half an hour is I'm going to briefly talk about autism and what it looks like and what parents should be aware of, the early signs that they should be aware of, when they should get help, and what early intervention should look like. So, and meanwhile, I think if there are any questions, please feel free to send them through, and I will do my best to answer them. So, as we all know, that young children develop in different ways. Uh, right from the time that they are born, they develop in different ways in terms of how they learn to move their bodies, in how they learn to think, in how they learn to communicate with those around them, and in how they are, looking at people, starting to make sense of the world around them, starting to build relationships. And this is all inborn, this is all innate. Many of these things just come naturally to us. It's very rarely that we have to teach little babies to learn how to hold their neck up or learn how to say their first words or learn how to look at people and smile. So all of this, children are neurologically wired. However, certain conditions, certain times, this neurological wiring seems to go awry. And what happens is that the way certain children understand and process the world around them is different. And they may not be able to communicate and interact with those around them in the same way that other children of their age are. And there could be many reasons for doing so. One of the most commonly encountered reasons for children having difficulties with communication and interaction is autism or autism spectrum disorder. So, autism spectrum disorder is a neurological condition, but more specifically, it's a neurodevelopmental condition. What do I mean by that? Neurological, because the underpinnings are neurological. There are neurological difficulties, differences in the way that their brains are wired that lead to changes in how their development progresses. So, young children with autism often struggle with the early parts of communication, with the early bits of social engagement. So, what do I mean? So, we know that young babies, they love to look at, mom and dad faces, respond to them. They love to make cooing sounds. And we often engage in what is known as reciprocal, sounds with them. We make sounds, they look at us and they gurgle back. And then we, kind of have this going back and forth between the parent and the child going on. And this reciprocity sometimes is the first thing that parents may notice is not there. Parents may say that the baby just doesn't seem to look at faces and may seem more interested in toys and objects around. The other things that parents may notice is that in the latter part of the first year, when you call the baby by name, the baby doesn't seem to respond. While the parent is totally confident that the baby does hear because the baby pays attention to other sounds in the environment, but may not look when he or she is called by name and may look very inattentive. So that's another early sign that we want to be aware of. If the child has not started babbling by the end of first year, does not have at least first words by the end of, say, 1.5 years, is not putting two words together by the end of the second year, you don't see a lot of joyful smiles, then again, those are red flags that we want to be aware of. And if you notice as parents or as caregivers of little babies, if you notice some of these signs, then you definitely want to bring them up with your pediatrician, or you want to bring them up with a developmental pediatrician and get the child assessed. um, so often we come across parents who reach out to us, as developmental pediatricians, about a diagnosis. And that's where our job comes in. I know I launched straight into autism without telling you what is it that we do. But I wanted to give you a sense of what is it that we work with. So when parents have concerns about their child's development, they reach out to um, pediatricians like us. So we are pediatricians with a specialization in developmental pediatrics. And I work in an organization called Ummeed Child Development Center, which is in Lower Parel in Mumbai. And we've been working in the field of developmental disabilities and difficulties for the last 18 years. Autism is one of the most commonly, encountered conditions that we work with in our clinic, in our center. And over here, we not only work with parents on diagnosis, assessing children, giving parents strategies, but we also do lots of trainings for parents in how they can learn to help their own children with developing skills. So, when I was talking about how, autism is a condition in which we need to be aware of early difficulties, you may have noticed that at no point did I say that autism is a disease, because it is not. Autism is not a disease. Autism is a condition in which developmental patterns are different. Since it's not a disease, we are not looking for a cure. But what we are looking for is to help children with autism attain their full potential, to acquire the skills that they are struggling to acquire. And we do so through therapy or intervention. And in fact, with good quality intervention, you know, many children will go on to, have meaningful, productive lives. Um, so we had already had some questions from parents out there who had very kindly posted some questions. And I remember that one of the questions was about a cure. And like I said, there's no cure, but there is definitely significant chances of progress. With good intervention, children can definitely do progress. Now, intervention may look differently at different points. Some children who are young, we start off by helping them be engaged. So like I said earlier on, that it's hard for children to build reciprocal relationships with their close ones, with their parents, with their caregivers. And why is that important? Because when you're engaged, when you're with a parent, that's the basis on which we learn language. So a parent says, "Oh, look at that, that's a birdie," and then the child turns around and looks, and then the child learns a new word, and the child learns, "Oh, that's a birdie," and the child looks back and shows something else on his own, and then the parent says, "Yes, that's what, that's a dog or something, that's an animal," and it goes, "Bow wow." And this back and forth between the parent and child continues and forms the basis for new learning to happen. Because this doesn't happen naturally in children with autism, this forms the basis of what intervention in early years looks like. this work on interaction, this work on engagement. And often it starts with focusing on the child's likes, focusing on what is it that grabs the child's interest, and using that to teach the child to communicate more, to interact more, to ask for it more. In addition, children, as we said, the children with autism may struggle with, um, certain behaviors. And behavior, learning to manage challenging behaviors is also another part of what we do with autism. Now, there was a question about repetitive questioning or repetitive use of language, and one mother specifically said that her child is learning. He has learned how to request for food when he is hungry, but he may end up saying, "I'm hungry," whenever he's angry or frustrated as well, and how we can work on that. Now, so what we sometimes see is that when children are acquiring communication skills, some of these skills are very rudimentary, and they may not know enough words or enough forms of communication to communicate a variety of needs. And they may use what they know to express various things. So then our job as caregivers is, now suppose a child is looking really upset because he can't open his box of favorite toys, and he says, "I'm hungry." I'm just, hypothesizing here. So then it's a good opportunity for us to say, "Open box, open," which means we use that opportunity to teach a new word instead of saying, "No, this is not food, you're not hungry, this is not what you're supposed to say." So use that opportunity to teach a new word. Okay. I want to pause a little and wait and see if there are any more questions. If the moderators want to, ask any more questions, then please go ahead and let me know. Or we could just, should I wait for questions or should I just go ahead? Okay. There was another question. Okay. So someone's asking that there's a baby who's 3 years old, and there are a few signs that we feel are not usual, like repetitive actions and no proper talking. Okay. So a child who is 3 years old and is not talking as yet definitely needs to be shown to someone. So, like I said, first words usually come in by 1 year. By about 1.5 years, children have close to 16 to 18 words or word approximations. And by 2 years of age, they're often joining words. They're saying things like "mama give" or "papa chalo." And if that is not happening, along with, in addition to difficulties like, the child is not responding when parents call him, and the child seems very interested in a very few toys or seems to play very repetitively, then these could be things that need to get checked out for. So, yes, Mrs. Sharma, I would recommend that your friend get the baby evaluated. So while we wait for other questions, there was another question from a mother about special schools for a 3-year-old and how she is struggling to get the child in school. Now, this is a question that is very commonly asked, sometimes not so early as this. So, for a 3-year-old, if a school is denying admission, then I think what the school is telling you is that they are not equipped to handle a child whose needs may be slightly different. As parents and as those of us who work with children with autism and other difficulties, developmental issues, we recommend that we look at settings that have the attitude and the willingness to support when children's needs are different. Because if that's not there, then it gets really hard. And these could be just normal, regular, inclusive schools. They don't have to be special schools. Okay. So, Rupa has a wonderful question, and she's asking that sometimes such kids may be very shy in social gatherings like parties and events. And is there anything that others can do to make them feel comfortable? That's an excellent question. Um, Knowing that social gatherings are probably hard for such children, and these could be hard for many reasons. It could be that it's hard for them to interact with others. It could be hard because a gathering means a lot of people, a lot of sound, maybe a lot of noise, bright lights, and some of these issues may be hard to the sensory systems of many children with autism. Knowing that they may not be very comfortable, I think what's really important is to not push them into, okay, why don't you come and talk or tell us your name or come and do this. But often what we say is, sometimes follow the child's lead. If the child wants to observe the goings on, wants to observe the cake cutting a little from the side, that's okay. And it's okay also to probably ask the mother about how can we engage him or her, because often the parents, the mother or the father, whoever it is that the child has come, because they will be able to offer some really good input about what works for the child. So for instance, I had a kid where the parent said that he loves jumping around, but he gets very scared if somebody hands him a balloon. And the well-meaning neighbors didn't know that, and they handed a balloon to this little child, and the little child had a huge tantrum. So to maybe even ask the parent in advance over a phone call that we would really love your child to be part of this party, what can we do different to have him included in this? The parent might say, can I come early and leave a little early before it gets too crowded? So they may be, that could be some things that you consider. So there's a question about how do we handle puberty, and because she's now becoming even more cranky and violent, what do I do to handle her? um, Now puberty is a tough time for boys and girls. It's a time of lots of new changes. The body is no longer how it was earlier, and we know that for children with autism, familiarity is good and changes are hard. So now the body is changing, maybe the way she's feeling is changing, and it's really hard for her. Depending on the child's ability to understand concepts, we have to help her understand what's changing and what's new at a level that works best for her. So if a child is non-verbal, we might use pictures. For children who are verbal, we might use pictures and social stories and a combination of simple paragraphs and pictures to express. Also, if it's just the time of the periods, sometimes just simple things like having a painkiller helps. Having a calendar on which the dates of the periods are visually chalked out so that the child has a mental preparation for the days ahead often helps the child be ready for this period, and it just doesn't come on her. And of course, we recommend that changes preparation for puberty has to start much before puberty. We want to make sure that children are able to handle themselves and their bodies and understand concepts of privacy much, much earlier. So we don't want to wait till puberty hits to start preparing. Okay. What is better, ABA or play therapy? And my daughter seems to respond better to play therapy. Um, okay. Now, I so therapy has to be tailored to the child's needs and the goals for the child. So, for instance, um, ABA is basically it's the behavioral it's the science of behavior. I mean, applied behavioral analysis per se is not really a therapy, but ABA forms the basis for many different kinds of therapies, right, from DTT to some extent to PRT to even the science of ABA informs therapies, communication methods like PECs as well. um, what is important is what is the goal that we are working on. Now, if we are working on getting a child to engage and to request and to be with someone else and have fun, then using play as a medium often works, because for many young children, that's what they like and they enjoy most. And that is why they respond better through play. Now, ABA, when done well, done in naturalistic settings, can work beautifully as well. Even DTT has a lot of evidence to it about how it can be used to teach a variety of skills. And in fact, ABA has the strongest evidence base. Once again, that being said, the kind of it's not just about what kind of intervention works, but it's about who is the interventionist, how well do they know the child, what are the child goals that you're working on. So if it is teaching the child to discriminate between two things and two objects, a more ABA structured tabletop activity or a tabletop session would possibly work better. If you are getting the child to engage, request, look at you, have some mutual sharing, a play based method, a child led method may be more appropriate. Okay. So, can a autistic child be diagnosed when in the mother's womb? I'm pregnant and would like to know. Okay. So, there aren't prenatal diagnostic tests, unlike, say, it's a condition like Down syndrome, where autism can be accurately diagnosed before a child is born. We do know that the chances of the probability of having another or second child with autism is higher, anywhere between 5 to 15% higher than in the normal population, if the first child also has autism. That being said, there's also a 85% chance of having a child without autism. Autism till now is not a diagnosis that is done by any blood test or by a radiological diagnosis or by EEG. It's a behavioral diagnosis. It is based on the child's development and the observation of how the child plays and responds and communicates. So at this point, a prenatal diagnosis of autism is not really possible. Okay. Yes, Ummeed Child Development Center is based only in Mumbai. And like I said, Ummeed has been around for 18 years. We have only one center in Lower Parel. And we help through a variety of ways. We have a clinic in which we do diagnosis, not just of autism, but also other developmental difficulties. So we are not just working with autism, but we work across, say, cerebral palsy, learning difficulties, ADHD, other causes for delays, depression, mental health conditions. So a variety, we work across difficulties. We look at diagnosis, we look at providing intervention and therapy. So we have an autism intervention team that works only with children with autism, and they work on developing communication, social skills, play skills, attention. Then, in addition to that, we have occupational therapists who work on sensory issues, coordination, awareness levels. We have speech therapists who work on higher order language and the pragmatics of speech. We have a strong mental health team that focus on mental health issues and emotional well-being. In addition to therapies, one-on-one, we do dyads, we do groups to develop social skills. We also run many parent training programs to equip parents. So, for instance, we run UPA, the Ummeed Parent Program for Autism for parents of young children. We do workshops on managing challenging behaviors, toilet training, preparing for puberty. In addition, we do a lot of training for professionals, teachers from other places in the country. So these are the broad ways in which we work. I see I have one other question. So someone's asking that they have a 3.1-year-old and he has been detected with mild autism and his memory is sharp. Oh, how wonderful. That's great. Many parents will comment on how their children's memory is really sharp. That's great. Will he have autism all his lifetime? Now, autism is known to be a lifelong condition. However, what you see today is not what you will see years down the line. So every child will make progress. Every child will learn new skills. So many of our children are, going through regular schools, getting into higher streams of education, making friends, and developing their interests. Yes, a definite fraction of them will continue to stay dependent, but even then, we can help them learn to be independent in their everyday life and acquire the skills that can make their life meaningful. So I think we are moving towards the end of this segment today. Thank you so much, all of you. Bye bye.